स्माइलिंग के साथ बात कर रहे हैं। उनसे सर
Yes. Hello, friends. Good afternoon, everyone. I'm Dr. Lakshmikanth, internal medicine consultant from Belenus Champion Hospital, Sarjapur Road, Bengaluru. Today's topic for discussion is we will be discussing about dengue fever and its basic information about that. So dengue fever literally means breakbone fever. So dengue fever is a viral infection which spreads through mosquitoes to humans. So usually the dengue fever is widely prevalent in tropical regions and subtropical regions of the world. And most often than not, the prevalence is much more in urban areas and semi-urban areas. So how does the dengue fever spread actually? The dengue fever spreads from a mosquito bite, which the mosquito takes the blood from an infected human, and then the virus replicates within the mosquito, and whenever the mosquito bites another person, the virus is transmitted to that particular person, and then in that person the infection further progresses. So this is how basically this dengue virus spreads. So, what are the symptoms of dengue? See, dengue can present in three forms. One is a mild form without warning signs, and the other one is a moderate form with warning signs, and there is a thing called severe dengue, which has very drastic manifestations. So, coming to the mild dengue fever. So, what is this mild dengue fever? So, any fever which is present for 3 or more days, it can present with rashes, it can have lot of headache, people can have joint pains, muscle pains, back pain, and particularly pain behind the eyes, and a feeling of dryness and soreness of the throat. So, these are the features of mild dengue. So, coming to dengue fever with warning signs. See, what are the warning signs? Warning signs basically are along with fever, joint pain, and muscle ache, people can have abdominal pain, frequent vomiting, diarrhea, and people can feel agitated, have lot of lethargy, and along with that blood investigations which shows reduced platelet count and increase in hematocrit or PCV values. So these constitute the warning signs which can occur with dengue. And coming to severe dengue, in severe dengue cases, people will have confusion, drowsiness, sometimes unconscious state also, along with a lot of fluid collection within the chest cavity and the abdomen, which can lead to breathing issues. Along with that, significant drop in blood pressure also happens in severe dengue, along with wide derangement of LFTs and RFTs, the kidney function and the liver function tests. So, this is what constitutes a severe dengue. In most often than not, the dengue presents as mild or moderate. So, this is about the presentation of the dengue. So, when should the people come to a hospital or seek medical help? So, whenever a fever crosses 3 days, usually without any symptoms pertaining to a particular organ like cough, rhinitis, or anything else, you should visit a doctor to clarify whether you have dengue or not. See, dengue can have similar features to other viral infections as well, which are spread through the same mosquitoes like chikungunya, Zika, and malaria. So, all these infections have to be ruled out, through the thorough clinical examination and particularly blood tests. Without blood tests, you can't determine whether a person has dengue for sure or not. So, whenever the fever crosses 3 days, people have to seek medical help and when they have warning signs. So, this virus is transmitted through a mosquito called Aedes aegypti. And this peculiar thing about this mosquito is it bites mostly during the day rather than at night. And this mosquito breeds in clean water as opposed to a common myth that mosquitoes breed in dirty waters. So we have to keep our surroundings clean and dry so that the rainwater doesn't get collected around our houses and allow mosquitoes to breed. So these are the things which you need to take care of to get protection from dengue. And coming to the blood tests, see, basically, when we test for dengue, we test for antigen and antibodies. There are three components in the dengue testing. So, one component is NS1 antigen, which becomes positive immediately, almost immediately, but the turnaround time is usually 3 days following the first onset of fever. So, in the first 3 days, antigen will become positive, and the IgM antibody might turn positive as early as fourth day or by the end of 1 week. If at all a person is negative for NS1AG as well as IgM, but only is positive for IgG, it means that the person has already recovered from the existing infection, or it is a feature, it is a symbol of a past infection. So the IgG antibodies only becomes positive past the first week. So coming to the duration of the dengue fever itself, see, the fever starts in a person only after the virus has entered, following which the virus has to multiply in the body for around 3 to 4 days. The normal incubation period is the period where the virus multiplies in the body before the onset of fever. The average incubation period in dengue fever is 4 to 6 days. It is only after that the virus presents with fever, and this fever can last for 3 days typically, which is called the febrile phase, and then following 3 to 4 days, the fever settles down, and in the next 3 days, even though the fever has settled down, people can have a lot of other symptoms which happens due to plasma leak. There is something called as plasma leakage which happens because the small blood vessels are damaged by the virus, and the virus also damages the platelets, which leads to reduction in platelet counts. So this plasma leak happens following the febrile phase, and this phase is called as critical phase in dengue, which happens after day 3 and day 4, which can extend up to day 7. So, from day 3 to day 7 is the period where the persons with fever, dengue fever, need to be vigilant. So, this is the time when all the warning signs of dengue can appear in few people. If such warning signs appear, you need to seek medical attention immediately. So, after 1 week comes the recovery phase, and most of the cases of dengue recover after a week, day 7 to day 10. And most of the cases, don't, in most of the cases, viremia or the virus inside the body gets cleared past 10 days. So, this is the time duration of the dengue fever infection. So, coming to the treatment of dengue, see, treatment wise, there is no treatment as of now available to kill the virus. So, all we need to do is to look for warning signs of dengue, and if people have severe symptoms, symptom management, and if the person is not able to eat or drink, has persistent vomiting, severe symptoms, then admission in the hospital for fluid management and as well as to monitor the platelets. If the patient has bleeding symptoms, then he needs to get admitted immediately and get platelets transfused. And people need to avoid the other kinds of painkillers like brufen and aspirin, because these tablets will lead to reduction in the platelet counts, which is already being destroyed by the viruses in the body. So the safest tablet to take in dengue is paracetamol. Brufen and aspirin has to be avoided if a person is suspecting dengue. That means the fever has crossed 3 days. So this is a brief outline about the management of dengue. And we will be taking questions from the viewers in a few moments.
So, sir, there are questions raised
Yeah.
by the viewers. That is, what happens when platelets goes down? So, what happens when the platelets goes down is a question raised by the viewers.
Yes. See, usually the platelets are stable for the first 3 days when the patient has a lot of fever. The platelets usually go down in most cases from day 3 onwards. So when the platelets goes down, the patient can have bleeding symptoms. That is bleeding from the nose, bleeding can be from the gums, bleeding can, come in the form of blood in stools, blood in vomiters, or blood in the urine. So, in order to avoid these bleeding complications, usually we transfuse platelets to a person where the platelet count drops below a critical value. The WHO says it is about 10,000, but the safe limit would be 20,000, which is the platelet count. So above that level, there will be no need for platelet transfusion, but obviously we will have to monitor the patient's blood pressure and maintain the blood pressure to a good extent.
Okay, thank you, sir.
Yeah.
So there is another question, that is how many days it will take time to recover?
See, the normal time of recovery in any dengue case is 7 days, 7 to 10 days.
Okay.
And it is a self-limiting disease. Without, see, as it is, there is no injections or medicines available to kill the virus. It is a self-limiting disease. The virus will eventually die or will be killed by the body in a time of 7 to 10 days.
Okay, thank you,
Yeah.
sir. So next is, what are the precautions to be taken?
See, the only way a person gets protection from the virus is to stay away from the mosquitoes. So the once you don't get bitten by a mosquito, there is no chance that you can contract the virus.
Okay. Yes, sir. So, can you explain us what will be the symptoms just to take a precaution?
Yes. The normal symptoms, average symptoms would be fever, body ache, muscle pain, joint pains, pain behind the eyes, and rashes. Along with these symptoms, the symptoms which are dangerous or what are all called as warning signs are abdomen pain, frequent vomiting, diarrhea, and bleeding from any of these places, as I had mentioned earlier. Or if the person has extreme lethargy or he has become drowsy or agitated.
Okay. So during this dengue time, what food you would recommend the patient to take?
Yes. So during dengue, because there is a lot of gastritis and there is gallbladder swelling also, people usually will not be able to digest solid food and hard food like roti, chapati, and such things. So people should concentrate on hydrating themselves and have to take lot of fruits and vegetables.
Okay. Thank you, doctor. So the next is, can dengue be spreaded?
Yeah, dengue can definitely spread from one person to another, but only through mosquito bite or through blood products. So essentially, that means dengue can't spread through touch, dengue won't spread through cough, dengue can't spread through droplets. It only spreads via mosquito bite.
Okay. And what can be done to reduce the risk of dengue, sir?
So basically, one has to get rid of mosquitoes or stay away from mosquitoes. And if a person gets dengue infection from a particular type of dengue virus, see, there are four types of dengue virus in total: type 1, type 2, type 3, and type 4.
Okay.
If a person is infected with one particular type, he will have immunity from that particular kind of dengue virus lifelong. If he has to get protection from the other serotypes, unless he is infected with another serotype, he will not get protected from that virus. The only way is to stay away from mosquitoes and get rid of mosquitoes.
Okay, sir.
Sir, is it place to place variation will be there, because in our state we don't have any much like this in
Yes,
Bangalore.
place to place variation of dengue incidence is also there. Particularly, it is seen, in tropical climates and subtropical climates. That means where the temperature is good enough or is suitable for mosquito breeding. That means hotter climates and somewhat temperate climates. Otherwise, the mosquito finds difficult breeding in colder places. So that is why we have less number of mosquito-borne diseases in cold countries and during winters. And it is more so prevalent in urban areas because urban areas have a lot of water logging, and the population density is so huge that the spread of the virus through mosquito bites is very easy. So basically it is more prevalent in crowded areas and hotter climates and during rainy seasons.
So what should I do if I suspect I have dengue, doctor?
See, if any person starts having fever, body ache, and rashes, if it goes past 3 days, you have to go to your nearest doctor and get yourself tested via blood sample. That is the only way you can know for sure that you have dengue or not.
Okay.
So, so these are the basic facts about dengue which we have outlined here. So, if you have further queries, uh, people can reach out to our hospital. Thank you.
We have to refresh. No?